Alrighty, so here's a question for you. Is popping a pill something you do on a daily basis? I do.
Well, so many of us take medications maybe to lower our cholesterol or to treat high blood pressure. In fact, a recent study shows about half of Americans ages 65 and older take 5 or more medications, many of whom mix prescription drugs, over-the-counter medications, and herbal supplements.
If you're not careful, the drugs meant to save you could actually do more harm than good.
Pill after pill after pill. From prescription pills to over-the-counter meds, mistakes put at least 1.3 million Americans at risk of death each year. One of the most reactive foods, grapefruit. The fruit's juice can interact dangerously with drugs like Zoloft, Allegra, and Lipitor, potentially causing heart rhythm problems and blood clots. Another deadly combo? Popular medicinal alternatives like garlic, ginger, and ginkgo supplements, when taken with blood thinners, can cause the blood to become too thin. Another combo to avoid: antibiotics and dairy. Milk and calcium supplements can stop the absorption of antibiotics, potentially worsening an infection. Just a little medicinal food for thought.
All right, so we mentioned blood thinners. Blood thinners can also react differently to foods high in vitamin K, like leafy greens. But if you eat salads regularly, it's okay. Don't worry about it. Experts say only sudden spikes in vitamin K are dangerous with blood thinners.
So how can we prevent these adverse reactions, and what other dangerous combinations are on the list? Well, joining us today with more is Dr. Kimberly Couch, a clinical pharmacist and assistant professor of pharmacy practice and administration at the University of Maryland, Eastern Shore. Thanks for joining us this afternoon. Now, we mentioned some of the adverse reactions of mixing these foods and these drugs. It can be pretty serious, can it?
It actually can be pretty significant interactions for patients and can cause some serious problems for them. Some of the problems, as you mentioned before, were the vitamin K foods with the blood thinners, which can cause the blood to not be thin enough and cause blood clots to form. And it's not just the green leafy vegetables, but also things like green tea that has a lot of vitamin K in it.
Okay, we just talked about a couple of those. Tell us more about, because you brought a lot of stuff here to show us what some of the combinations could be that could be hazardous.
Sure. So the green leafy vegetables like collards and kale, and then the green tea with the anticoagulants or blood thinners.
Right.
Consistency is the key there. So you want to make sure that, if you enjoy those vegetables or green tea, that's fine. Just consistency is the key, not like a sudden amount of green leafy vegetables or green tea.
What about antidepressants? I've heard, cheese and can mix with antidepressants in a bad way.
Sure. So some of the older antidepressants, which are used less regularly now, but are still really good medications to use for certain patients, can actually interact with some of our fermented types of foods, as well as cured meats and aged cheeses like we have here. And what can happen is there's a chemical in those particular foods called tyramine, and that's essential for our body to maintain our blood pressure. But what happens is this older antidepressant prevents that from breaking down in the body, and you get very high levels of blood pressure. And those really high levels of blood pressure can be very dangerous and can lead to stroke in some patients.
Okay, so we talked a little bit about dairy. Can dairy really be an issue?
Dairy actually can be an issue with certain antibiotics. And so, just the glass of milk or the cup of yogurt you may have with your breakfast, if you take your certain antibiotics with that, like levofloxacin or doxycycline, it actually prevents that antibiotic from getting into your body's bloodstream and going to that infection. So if you mix those together, unfortunately, you're not getting the antibiotic effect that you're looking for, and your infection doesn't get better.
Now, and it's not just food. You mentioned milk, but there's other beverages that can mix adversely with drugs.
That's true. So we have some things here like grapefruit juice, grapefruit itself. These can interact with some medications and can actually cause too much of the medication to be in our body, and can lead to deadly things like differences in heart rhythm and also increased side effects of medications, like some cholesterol lowering medications where you get the muscle cramping and things like that. And then lastly, alcohol is one thing that we want to really pay attention to. Some of the over-the-counter medications like acetaminophen, if you take more than 1 or 2 drinks a day, you really have to be very careful about how much acetaminophen that you're consuming.
Right.
And that's in all products, not just, you know, a pain reliever, but cough and cold preparations as well.
Okay, so are there some things that we should just simply not mix with anything except maybe water?
There are certain medications which shouldn't be taken with any foods whatsoever or any beverages other than water. And those are some of the medications we use for preventing or treating osteoporosis, as well as some thyroid medications. And if you take those with anything other than water, it doesn't get absorbed into the body, and so you don't have really good use of that medication.
So what would be your suggestion to avoid any of these interactions?
So avoiding any of these interactions, you want to read your drug labels very carefully. So if there are any of those issues, the pharmacy where you have your prescription filled will have that information on your prescription label. In addition, you know, learning about the drug warnings and really talking to your pharmacist. Take the extra couple minutes to talk to your pharmacist and find out, are there any things that I should avoid with this particular medication? Are there any things that I should do differently than what I'm doing now?
It's always good to ask.
Check with your pharmacist, and that includes over-the-counter too, doesn't it?
It does.
Dr. Couch, thank you so much for joining us today.
My pleasure.
Wonderful information.
And if you'd like to read more about the dangers of mixing certain medications with certain foods, go to delmarvalife.com and click on the show tab.
Okay, we're going to stick with your health, all right? Actress Angelina Jolie made headlines this year after undergoing a double mastectomy. A doctor told her she had a pretty good chance of developing breast cancer because it runs in her family. Your family's history can also say a lot about your health. Genetic counseling can help you understand it, and we're going to learn more and find out who should consider it.
And later, we're in the kitchen cooking it up, barbecue style with Old South Barbecue and Catering. Plus, we'll tell you how you can yourself a barbecue dinner, all while supporting a great cause. Sorry. Yeah, you can enjoy.
Okay, so we're going to stick with your health. Actress Angelina Jolie made headlines this year after undergoing a double mastectomy. Doctor told her she had a pretty good chance of developing breast cancer because it runs in her family. Your family's history can also say a lot about your health. Genetic counseling can help you understand it, so we're going to learn more and find out who should consider it.
And later, we're in the kitchen cooking it up barbecue style with Old South Barbecue and Catering. Plus, we'll tell you how you can get yourself a barbecue dinner, all while supporting a great cause.